Hello and good afternoon once again. 18th of August 2021, Wednesday, and this is the English language summary of the daily press briefing of the CCSA. So Dr. Pisamai gave us some very useful information, recapping the morning meeting that we had, the CCSA daily meeting that we had, including the issue about the efficacy of each of the vaccines, as well as the efforts to have a continuous supply of the vaccines in Thailand. So on the vaccination progress, I'd just like to mention off with this first, that yesterday we recorded over 500,000 doses of vaccine administered. To be exact, it's 518,118 doses of vaccines were administered. Now, if you notice in the weekends or in public holidays, usually there would be a lesser number of vaccines being administered, but on weekdays it would be kind of higher. We had the maximum of around 680,000 doses of vaccine per day, and the total number of vaccinations now in Thailand amount to over 24.6 million doses. So you see that on screen right now, the number of doses, 24.6 million. If we dissect that into the first dose and the second dose, for yesterday, for example, 518,000 doses. First dose is 355K, and second dose is 153K, and you have the third dose as well. Now, just in Bangkok in particular, I'd just like to mention that vaccines have been administered to people 60-year-old and above, as well as the general public, as well as those with the 7 underlying diseases. So that's been going on in various schemes and locations in Bangkok already. And I mentioned Bangkok because it remains to be the epicenter of the infection. Now, in Bangkok in particular, for those who are 60-year-old and above, we have information that those who are age 60 and above, having taken their first dose, we have already administered 93.25%. So 93% of those that are 60-year-old and above in Bangkok have already received their first dose, which is a very good number. Likewise, in Bangkok, those with 7 underlying diseases have received, most of them have received the first dose already as well. We have in detail, which is 96.23%. So therefore, those people registered with 7 underlying diseases in Bangkok, those in Bangkok with 7 underlying diseases, 96% have received their first dose already. So this comes to show that those in vulnerable groups, the majority of those in vulnerable groups have already received their first dose in Bangkok, which is a very good progress. Additional information which will be of interest to foreign nationals, aside from the expat vac scheme, that's a collaboration between the Foreign Ministry and the Public Health Ministry, just to inform you also that the Julapon Royal College will open the registration for vaccination for those aged over 18-year-old and have never been vaccinating, starting tomorrow on the 19th of August at 9 a.m. And that approximately 20,000 doses of vaccines will be inoculated free of charge from the 19th of August to the 3rd of September. The first dose of vaccine is either AstraZeneca or Sinovac, and the registration can be made through the website there. So we'll have an infographic up on screen for you from the Julapon Royal College. Yes, that's up on screen for you right now, and you have the details and the QR code there that can be found on their social media Facebook page as well. So this is just another channel for vaccination of foreign nationals aside from the ones that we mentioned. This is for your information. For the general situation, we have new confirmed case at 20,515 cases, as compared to the new recoveries recorded yesterday, which is 22,682. So now, for yesterday at least, we have more new recoveries than confirmed cases. Current cases, active cases still being treated is 207,553, as you see on screen. Unfortunately, we have 312 fatalities recorded for today. Now, just a note on this is that this is a new high in terms of the daily numbers, but just an important note that this high fatality rate is because some provinces in the past day had reported the accumulated number of fatalities, meaning that they reported the fatalities a bit late, meaning they accumulated fatalities in the past, for example, 2 or 3 days or more, and then they informed our central agency, the CCSA, a bit late. So therefore, the number was added on to the total fatalities for today. So therefore, the fatalities for yesterday, for example, is not actually this high. It's an accumulated number from 2 or 3 days or more. This was a reporting from a few provinces only, so this number had to be added on for today. However, the cumulative number of fatalities now we have at 8,285 with the 312 added from yesterday. This remains 0.87% fatality rate. No matter how low or high the fatality rate is, how many fatalities we have, a low number or a high number, it's still something that we very much regret, and we do not want this to happen. So just some observations, particularly for Bangkok. Just now I mentioned about the 60-year-old group and the group with the 7 underlying diseases, that most of them, over 93%, 96% have already received their first dose. That's a very good progress that we are hearing, our feedback from the information that we receive from the field. Another percentage, which is a good news, is that in Bangkok in total, meaning the whole city of Bangkok, there had been inoculation of the first dose for 79% of the entire Bangkok population already. So we can say that around 80% of people in the entire vicinity of Bangkok had already received at least their first dose of the vaccine. However, Bangkok still remains the highest with the highest number of infections today. You see that on screen with over 4,000 cases, followed by other provinces nearby Bangkok with Samut Sakhon and Samut Prakan coming in second. And you see the numbers there on screen. The reports of infection remain from those found in the various locations that we mentioned, hotspots, the factories and markets. And majority of fatalities remain to be those who are 60-year-old and above, and those with the 7 underlying diseases. Now, a little bit about Phuket. I'm sure the English language audience would be interested. That when we mentioned on Monday, 2 days ago in the briefing, that the CCSA general meeting had approved the new measures for the 7+7 scheme for the Phuket sandbox. And this was effective already since yesterday. For those who have completed their quarantine in Phuket, meaning traveling from abroad in the Phuket Sandbox scheme, arriving in Phuket and completing their quarantine in Phuket for 7 days already. Quarantine meaning you can travel around Phuket. After completing that, the visitors can now travel to other tourist destinations in the southern provinces of Thailand and be there for another 7 days before departing to other areas. So on screen, you have a list of the travel routes which are included in this 7+7 scheme. So meaning Phuket 7 days and one of these destinations for another 7 days. So you have there Phuket for the first 7 days, followed by Khao Lak, which is in Phang Nga, or Phuket, followed by other areas in Phang Nga, or Phuket, followed by PP Island in Krabi province, Phuket, and followed by all these destinations you can see on screen, which actually are very, very interesting destinations for travelers coming into the Phuket sandbox, which has now moved on into becoming a Phuket 7+7 sandbox. So travelers who wish to depart to those travel routes would have to have all the necessary documentation before coming in the country, the test results, the transfer forms, and of course the bookings for hotels in the SHA Plus program for the 7-day extension. And all traveling during the transfer will be transported by specific designated vehicles, which are separate from other travelers. And all travelers in the program would also need to have the third RT-PCR test on day 12 or day 13. And we need a release form before they can be allowed to travel to other parts of Thailand after the 14 days. So my very best wishes to this transition of the Phuket Sandbox scheme. Moving on to some good news, we have something about the clinical trial of the COVID-19 vaccine. We're in the King Chulalongkorn Memorial Hospital, and the Faculty of Medicine at Chulalongkorn University announced a promising preliminary result from the phase 1 clinical trial of the COVID-19 vaccine. So the director of the center said that the phase 1 trial was conducted with 36 volunteers aged 18 to 55, and that showed that the trial vaccine could help the body build a level of antibody response similar to the response of the Pfizer-BioNTech vaccine. The result from the phase 1 study shows that the COVID-19 vaccine can help the body elicit a high level of antibody response, effective in preventing illnesses from the in the wild type of SARS-CoV-2, as well as the Alpha variant, Beta variant, Gamma, and Delta variant and variants of concern. And the researchers, local researchers in Thailand, in July, are now going ahead with the phase 2 trial involving more volunteers, and the team will be selecting the appropriate dosage for phase 2 at the end of this week, while the actual study is expected to commence on the 25th of August 2021. If all goes well, this locally researched and produced vaccine will be available to the general public in Thailand by the month of April 2022. So just some developments, some updates there for you. And last but not least, the Department of Disease Control strongly suggested that everyone should follow guidelines for what they call the universal protection. And this was emphasized by Dr. Apisamai in the Thai language briefing as well. Universal prevention, even though you are still not in the high risk group. Now, this guideline for universal prevention is comprised of: number 1, first, leave home only when necessary. Number 2, keeping 1 to 2 meters of social distancing. Number 3, wear masks, surgical masks, together with a cloth mask. Number 4, wash hands before every meal. Number 5, avoid touching the mask and other parts of your face. Number 6, people in the high-risk category, meaning 60-year-old and above, and with the 7 underlying conditions, should avoid going outside. Number 7, clean surfaces regularly. Number 8, do not share personal items with others. Number 9, eat well-cooked food, and don't share your meals with others, meaning in terms of communal dining. Number 10, if you have feelings, any signs or symptoms of illnesses, or you might feel you have a risk of infection, regularly do the testing with the antigen test kit. So with that, I hope that everyone would stay safe and healthy. Please continue practicing all the measures that we have been talking about as the guidelines to protect yourself and protect your family. And this is all for today, and we'll see you again in the daily press briefing of the CCSA on Friday. สวัสดีครับ
กราบขอบพระคุณค่ะท่านณัฐพานุ นพคุณรองอธิบดีกรมสารนิเทศและรองโฆษกกระทรวงการต่างประเทศนะคะ